Hello my dear students. Welcome to AI Medical School. So today we are going to study about Introduction of Pharmacology, what is drug, what is pharmacodynamics, what is pharmacokinetics, drug nomenclature, and routes of drug administration. Pharmacology is the science of drugs. It deals with interaction of exogenously administered chemical molecules with living systems, or any single chemical substance which can produce a biological response is a drug. So what is drug? It is the single active chemical entity present in a medicine that is used for diagnosis, prevention, treatment or cure of a disease. Now come to what is pharmacodynamics. Its simple meaning is, what the drug does to the body. This includes physiological and biochemical effects of drugs and their mechanism of action at organ system, subcellular and macromolecular levels. Now what is pharmacokinetics? Its simple meaning is, what the body does to the drug. This refers to movement of the drug in and alteration of the drug by the body. Includes absorption, distribution, binding, localization, storage, biotransformation and excretion of the drug. Drug nomenclature. A drug generally has three categories of names. First, chemical name. It describes the substance chemically, for example. 1. Isopropylamino, 3. 1-naphthoxy, propan-2-OL for propranolol. This is cumbersome and not suitable for use in prescribing. And second is non-proprietary name. It is the name accepted by a competent scientific body or authority. Now the third is proprietary, brand, name. It is the name assigned by the manufacturers and is his property or trademark. One drug may have multiple proprietary names, for example, Altal, Tenolol, Tenormin for atenolol from different manufacturers. Brand names are designed to be catchy, short, easy to remember and often suggestive, for example, Loprecer suggesting drug for lowering blood pressure. Brand names generally differ in different countries. Even the same manufacturer may market the same drug under different brand names in different countries. In addition, combined formulations have their own multiple brand names. This is responsible for much confusion in drug nomenclature. Routes of drug administration. Most drugs can be administered by a variety of routes. The choice of appropriate route in a given situation depends both on drug as well as patient-related factors. Mostly common sense considerations, feasibility and convenience dictate the route to be used. Routes can be broadly divided into those four. Number 1 is local action and number 2 is systemic action. Local routes. These routes can only be used for localized lesions at accessible sites and for drugs whose systemic absorption from these sites is minimal or absent. Thus, high concentrations are attained at the desired site without exposing the rest of the body. Systemic side effects or toxicity are consequently absent or minimal. For drugs that are absorbed from these sites or routes, the same can serve as systemic route of administration, for example, glyceryl trinitrate applied on the skin as ointment or transdermal patch. The local routes are topical. This refers to external application of the drug to the surface for localized action. It is often more convenient as well as encouraging to the patient. Drugs can be efficiently delivered to the localized lesions on skin, oropharyngeal or nasal mucosa, eyes, ear canal, anal canal or vagina in the form of lotion, ointment, cream, powder, rinse, paints, drops, spray, lozenges, suppositories or pessaries. Deeper tissues. Certain deep areas can be approached by using a syringe and needle, but the drug should be in such a form that systemic absorption is slow. Arterial supply. Close intraarterial injection is used for contrast media in angiography. Anti-cancer drugs can be infused in femoral or brachial artery to localize the effect for limb malignancies. Systemic routes. The drug administered through systemic routes is intended to be absorbed into the bloodstream and distributed all over, including the site of action, through circulation. Oral ingestion is the oldest and commonest mode of drug administration. It is safer, more convenient, does not need assistance, non-invasive, often painless, the medicament need not be sterile and so is cheaper. Both solid dosage forms, like powders, tablets, capsules, spansules, dragees, molded tablets, and gastrointestinal therapeutic systems, and liquid dosage forms, like elixirs, syrups, emulsions, and mixtures, can be given orally. Sublingual or buccal, the tablet or pellet containing the drug is placed under the tongue, or crushed in the mouth, and spread over the buccal mucosa. Only lipid-soluble and non-irritating drugs can be so administered. Absorption is relatively rapid, action can be produced in minutes. Though it is somewhat inconvenient, one can spit the drug after the desired effect has been obtained. The chief advantage is that liver is bypassed and drugs with high first-pass metabolism can be absorbed directly into systemic circulation. Drugs given sublingually are GTN, like buprenorphine, desaminoxytocin. Rectal. Certain irritant and unpleasant drugs can be put into rectum as suppositories or retention enema for systemic effect. This route can also be used when the patient is having recurrent vomiting or is unconscious. Cutaneous. Highly lipid-soluble drugs can be applied over the skin for slow and prolonged absorption. The liver is also bypassed. The drug can be incorporated in an ointment and applied over specified area of skin. Absorption of the drug can be enhanced by rubbing the preparation, by using an oily base and by an occlusive dressing. Inhalation. Volatile liquids and gases are given by inhalation for systemic action, e.g. general anesthetics. Absorption takes place from the vast surface of alveoli. Action is very rapid. When administration is discontinued, the drug diffuses back and rapidly eliminated in expired air. Thus, controlled administration possible with moment-to-moment adjustment. Irritant vapors cause inflammation of respiratory tract and increase secretion. Nasal. The mucous membrane of the nose can readily absorb many drugs, digestive juices and liver are bypassed. However, only certain drugs like GnRH agonists and desmopressin applied as a spray or nebulized solution have been used by this route. This route is being tried for some other peptide drugs like insulin, as well as to bypass the blood-brain barrier. Parenteral. Conventionally, parenteral refers to administration by injection, which takes the drug directly into the tissue fluid or blood without having to cross the enteral mucosa. The limitations of oral administration are circumvented. Drug action is faster and surer. Gastric irritation and vomiting are not provoked. Parenteral routes can be employed even in unconscious, uncooperative or vomiting patient. There are no chances of interference by food or digestive juices. Liver is bypassed. Disadvantages of parenteral routes are, the preparation has to be sterilized and is costlier, the technique is invasive and painful, assistance of another person is mostly needed. There are chances of local tissue injury and, in general, parenteral route is more risky than oral. The important parenteral routes are subcutaneous. The drug is deposited in the loose subcutaneous tissue which is richly supplied by nerves, but is less vascular. Intramuscular. The drug is injected in one of the large skeletal muscles like deltoid, triceps, gluteus maximus, rectus femoris, etc. Muscle is less richly supplied with sensory nerves, and is more vascular. Intravenous. The drug is injected as a bolus or infused slowly over hours in one of the superficial veins. The drug reaches directly into the bloodstream and effects are produced immediately. Intradermal injection. The drug is injected into the skin, raising a bleb or scarring or multiple puncture of the epidermis through a drop of the drug is done. This route is employed for specific purposes only. I hope you guys liked the video. Press the subscribe button and hit the thumbs up. Thanks for watching.